Hi everyone, we've got a topic today which is corns and callus, and often people will screw their face up and disgust when we start talking about these, but they don't just happen to old people, and they happen to athletes the same as everyone else, and they need to be treated with respect. And what I really wanted to talk to you today about were these things here. So these are corn pads. Alright, so corn pads are potentially pretty hazardous and pretty dangerous. I would see on estimate in the last 20 years of practice at least between 3 to 6 cases a year where people have either applied these repeatedly and induced an ulceration, or they've applied them and the plaster has moved, and so they've developed a large area of maceration and it's actually burnt the surrounding skin, all of which require some attention and some treatment. Alright, so if you do have a corn, it won't just occur because it feels like it, it will occur because of the skin type, and usually that it's getting some degree of friction or it's having some degree of underlying bony pressure. Alright, and so you need to have it looked at properly and treated with the respect that you deserve. So avoid the temptation to treat these things yourselves. I know that sometimes if you're unaware of what they are and there's delays in getting in to see a doctor about it, come in and see us, more than happy to help you. And please like and share this video. If you have anyone that you know that may be using these or tempted to use these, please advise them not to. They can essentially be limb-threatening treatments if used on the wrong person, such as peripheral vascular disease, diabetes. There are some very light warnings on the back of the packet, but I don't know that a lot of people will bother to read them, and 40% of salicylic acid is quite a strong solution. So just a heads up, if any loved ones or people you know are tempted to use these or using them currently, advise them not to, and advise them to come in and see a podiatrist and get the corn treated properly.